Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. And today on VEC Vaccine Notes, we're going to be talking about meningococcus. Now, reports of meningococcus in a school or a community often unleash fear and panic because this bacterial infection can cause someone's death in literally hours. It's one of the most rapid and overwhelming infections known. Sometimes these deaths occur so quickly that treatment is not even an option. This is a demonstration of why, even with modern healthcare, we cannot always rely on treatments. The ability to prevent infections such as this one truly is a gift of modern technology. When people get meningococcal infections, they can experience different conditions based on where the infection occurs. We'll get into that a little bit more when we talk about this disease. But when we talk about why this infection brings about panic, the numbers are telling. Meningococcus can cause meningitis, which is an inflammation of the lining of the brain. When people get meningococcal meningitis, about 1 or 2 out of every 10 of them will die. And these are statistics from today, in 2026, in the United States. And that death rate is even more staggering when we talk about sepsis, which is a bloodstream infection. About 4 of every 10 people who experience sepsis caused by meningococcus will die. Some of them will die within 12 hours of becoming ill. Simply put, meningococcus is a horrible disease. During the next little bit, we're going to talk more about meningococcal disease, the vaccines that are available, common questions we receive here at the Vaccine Education Center, and the relative risks and benefits of this disease and vaccination. So let's get to it. Meningococcus is caused by a bacterium known as Neisseria meningitidis. Generally speaking, this infection is rare. About 350 people in the United States are infected annually. Unfortunately, about 50 of them die from their infection, and many survivors endure lifelong disabilities as a result. We'll talk more about that in a moment. Let's first talk about who's most at risk from this infection. People are more at risk during certain periods of life, meaning at certain ages, and in some cases because of certain activities. But the first thing to realize is that anyone can have a meningococcal infection. There are 2 groups at higher risk. The most at-risk group is infants less than 1 year of age, and unfortunately in the United States there's currently not a routine recommendation for meningococcal vaccination during infancy. However, some subgroups of infants do get vaccinated because they have other high-risk factors, and we'll talk more about what those details are when we discuss the vaccine. After infancy, the risk for meningococcal infections decreases throughout early childhood, but it begins to rise again during adolescence and throughout young adulthood. There are 2 main reasons for this increase during later childhood and early adulthood. First, this is a time when students are spending extended periods of time with new groups of people, such as at sleepaway camps, in military barracks, and in college dorms. New people may expose them to pathogens that they weren't previously exposed to, including this bacteria that causes meningococcus. Second, certain activities can also increase the risk for this bacteria to find its way into a person's body. For example, sharing drinks or utensils or kissing can introduce the bacteria. And things like smoking or vaping can disrupt the lining of the throat or the lungs, providing an opportunity for the bacteria to get into a person's bloodstream. Outbreaks of meningococcus can occur in settings where people tend to congregate closely for long periods of time, places like daycares and schools and universities and in military barracks. Now, we already talked about the fact that this bacteria can cause an infection in the lining of the brain, and that's called meningitis. People with meningitis can experience a stiff neck, a headache, a fever, and drowsiness. People can also experience sepsis or bloodstream infections, as we also mentioned. In that case, they may have a headache, they may go into shock, or they could even go into a coma. If the infection occurs in their lungs, they may develop pneumonia. And the infection can also occur in their joints, causing an inflammation of the joints and causing joint pain. As mentioned a few minutes ago, people with meningococcal infections are quite sick, and even when they recover, many are left with lifelong disabilities. This can include things like amputated limbs, hearing loss, seizures, kidney disease, intellectual disabilities, and some of them will even experience cell death during the infection that causes large areas of their skin to require grafting. Grafting is a procedure in which healthy skin from one part of the body is used to cover other areas where the skin has been lost or damaged. So let's talk about the meningococcal vaccines that are available. There are currently 3 versions used in the United States, and they're identified with letters that indicate which types of meningococcus they protect against. So let's go through them. The earliest meningococcal vaccines to become available are known as meningococcal ACWY vaccines, or MenACWY. As the letters indicate, these vaccines protect against 4 of the 5 types of meningococcal bacteria. These vaccines are made similarly to those that protect against 2 other bacteria that also cause meningitis, Haemophilus influenzae type B and pneumococcus. In all 3 of these vaccines, a sugar coating from the bacteria, which is known as a polysaccharide, is attached to a harmless protein in what is known as a conjugate. The reason the so-called helper protein is attached to the sugar or polysaccharide from the bacteria is that very young children, specifically those less than 2 years of age, don't really make very good immune responses to those polysaccharides when they're given alone. But when the protein is added, the immune system responds more strongly to the protein, and in the process, it also creates an immune response to these polysaccharides. There are 2 meningococcal ACWY vaccines that are currently used in the United States. Menveo has been available since 2010, and it can be given to people between 2 months and 55 years of age. Menquadphy has been available since 2020, and it can be given to people 6 weeks of age and older. The second type of meningococcal vaccine is commonly referred to as meningococcal B, or MenB for short. As the letter indicates, it protects against only one type of meningococcus. But this is the type that's responsible for about 2/3 of meningococcal infections in babies and about 1/3 of those in adolescents and young adults. So you might be wondering, why didn't they just add the meningococcal type B to the vaccines that we just talked about? And that's a good question, but it does have a logical and important answer, so let's go through it. The sugar coating on meningococcus type B is similar to a protein that we have in our bodies. So when it was used as a vaccine, we simply didn't make a good response to it. Now this is good news for us when we think about how our immune systems work, because it means that our immune system recognized that this sugar was similar to something else in our bodies, and it didn't make an immune response to it. That would be called an autoimmune or self-response. And from the perspective of making a vaccine, scientists wouldn't want to make a vaccine that could produce an immune response that might react with our own proteins or cause autoimmunity. So it was also a safety concern for using that approach. A different approach was needed, and scientists thought they had found it by using proteins on the surface of meningococcal type B instead of the polysaccharide. Unfortunately, these vaccines were also found to have issues. First, they didn't work well in infants. And second, the proteins changed enough that these vaccines had to be reformulated during each different outbreak. Those vaccines were used to control epidemics while researchers continued to try to find a better way to protect against meningococcal type B. And that finally happened in 2015 when 2 meningococcal B vaccines became available in the United States. Researchers had used other proteins that change less often, but still ensured protective immune responses when used as vaccines. Trumenba contains 2 proteins, and Bexsero includes 4 proteins. Now, once the meningococcal B vaccines became available, scientists and the pharmaceutical companies turned their attention to creating a combination vaccine that would contain both the meningococcal ACWY and meningococcal B vaccines. These vaccines, known as MenABCWY, are now available. Penbrea became available in 2023 and Penmenvy in 2025. Now, one important point here is that because these vaccines contain different MenB components, remember one meningococcal B vaccine has 2 proteins and the other has 4, if someone gets mixed doses, meaning a MenABCWY and a MenB vaccine, they need to get them from the same brand. Penbrea is the ABCWY version that contains the MenB component known as Trumenba. They're both made by Pfizer. On the other hand, Penmenvy is the MenABCWY that contains the MenB component known as Bexsero. They're both made by GlaxoSmithKline. So let's talk about who should get each meningococcal vaccine. The meningococcal ACWY vaccine is recommended for several groups of people. All adolescents and teens between 11 and 18 years of age, people without a spleen and those with a spleen that doesn't function properly, people who have a condition called complement deficiency. Now, complement is a particular group of proteins that are found in our blood, and they help us fight infections. If people have complement deficiency, they're at increased risk of not being able to effectively fight this infection. So that's why they get this vaccine. People with HIV, college freshmen living in dorms, people exposed during an outbreak of a type of meningococcus that's in the vaccine, specifically A, C, Y, or W. People traveling to sub-Saharan Africa between December and June, such as for the Hajj. Military recruits, and people who work with the bacteria in the lab. Those who are recommended to get meningococcal type B vaccine include teens between 16 and 18 years of age, those between 18 and 23 years of age who have not previously received the vaccine and could benefit from having it, those 10 years and older who have health conditions that increase their risk of infection, and that again includes things like people with complement deficiency, lack of spleen, a spleen that doesn't work properly, and also people who work with the bacteria in labs, and those who are exposed during a meningococcal type B outbreak. People who are getting both meningococcal vaccines at the same medical visit, meaning ACWY and MenB, can get the pentavalent version that we discussed, known as MenABCWY. Each type of meningococcal vaccine can cause injection site reactions like pain and redness at the injection site, but they generally don't cause any serious side effects. So now let's switch gears and talk about some of the common questions we receive here at the Vaccine Education Center. Meningococcal vaccines are sometimes referred to as the meningitis vaccine. And this can cause confusion that leads to questions about the causes of meningitis. So let's sort it out a little bit. The word meningitis refers to a situation in which someone has an infection in the lining of their brain and spinal cord. While meningococcal bacteria can commonly cause meningitis, many other pathogens, both viral and bacterial, can cause meningitis as well. If you hear that someone has viral meningitis, their infection's been caused by a virus, and generally speaking, viral meningitis is less severe than that caused by bacteria. Now, we do have some vaccine-preventable viruses that can cause meningitis, and those include measles, mumps, chickenpox, and even influenza. If you hear that someone has bacterial meningitis, their infection has been caused by a type of bacteria. While these infections tend to be more severe, most causes of bacterial meningitis can be prevented by vaccination. In addition to meningococcus, other common bacterial causes of meningitis include pneumococcus and Haemophilus influenzae type B, or Hib. Another question we get is whether college students should get the meningococcal vaccine. Short answer to this is yes, but let's talk about why. Young people who are college-aged are at higher risk for meningococcal infections because of common choices and situations that they find themselves in around this age. So definitely college students can benefit from receiving both meningococcal vaccines, especially if they live on campus. Studies have shown that college freshmen who live in dorms are 5 times more likely to be infected with meningococcus compared with those who live off campus or don't attend college. There's also one final important consideration related to this question. Although adolescents and young adults are less likely than infants to be infected with meningococcus, they're more likely to die from their infections. So vaccination is important. And if you remember, earlier we discussed the fact that sometimes deaths from this infection can occur so quickly that there isn't an opportunity to treat. People also reach out if someone in their child's school is diagnosed with bacterial meningitis, because they want to know if their child should be vaccinated or should receive antibiotics. So the first thing to know here is that typically in these situations, public health officials are going to be working with both school officials and the infected child's medical care team. One of the first things they're going to do is confirm which type of bacteria caused the meningitis. This can take up to 2 days. The officials will also work to determine whether there's an outbreak or if this is an isolated case. And with this information, they're going to be able to provide informed guidance to people who were exposed. For example, if there's an outbreak, they often will recommend that your child might get a version of the meningococcal vaccine that contains the type of meningococcus causing the outbreak. They're also going to try to work to define who has what's known as close contact. And this is a term used to mean something very specific in public health. In this case, it's who was around that person in the week prior to their diagnosis and who shared a classroom for more than 4 hours a day, kissed that person, or shared food and drinks. And it's this group of close contacts who are likely to be recommended to also take antibiotics. So let's finish up with a look at the relative risks and benefits. Today we talked about the fact that while not a lot of people in the United States get meningococcal infections each year, there are still about 350 cases, and about 50 of those people will die from their infection. Some of those deaths happen within hours of becoming ill. And in some cases, it occurs so quickly that treatment isn't an option. Likewise, many survivors will experience lifelong effects like seizures, amputations, kidney disease, deafness, intellectual disabilities, and some will also experience cell death that requires skin grafts. On the other hand, meningococcal vaccines do not cause severe reactions. For these reasons, when our team evaluated the relative risks and benefits, we determined that the benefits of the meningococcal vaccine outweigh the risks. And we hope when you've reviewed this information, you'll feel that way too. Thanks for listening today.